The emergency department was loud in the way it always was, monitors chiming in uneven rhythm, stretchers rolling across polished floors, voices layered over one another without ever quite rising into panic. Fluorescent lights flattened every color into something pale and clinical. The rookie nurse stood at the triage station with a tablet in her hands, scanning vital signs and updating charts with quiet efficiency. Her badge still looked new, the plastic unscuffed, the word rookie printed in small letters beneath her name as part of the hospital's mentorship program. Patients barely looked at her twice. Senior nurses moved around her with the comfortable authority of experience. She did not compete for space. She simply adjusted to it. She noticed everything. The man in Bay 3 whose breathing rate was slightly too fast for anxiety alone. The woman near the entrance clutching her purse too tightly. The security guard posted near the sliding doors who had shifted his weight to his back foot after glancing outside. None of this showed on her face. She continued entering data, asking soft, precise questions, and guiding patients with steady hands. Outside, faint shouting carried through the glass. It was distant, like wind forcing its way down a corridor. The protest had been building for hours a few blocks away. Most of the staff dismissed it as noise. The city had seen worse. The charge nurse muttered something about hoping it did not spill toward the hospital. Someone laughed nervously and said protesters did not target emergency rooms. The rookie nurse did not laugh. She tilted her head slightly, listening. The shouting outside shifted tone, less chanting, more fractured yelling. She watched the reflection in the glass doors rather than staring directly at them. Reflections told you about movement before you heard it. A small group ran past the entrance. One of them stumbled. Another looked back over his shoulder as if chased. The security guard reached toward his radio but did not press the button. The nurse returned her attention to the elderly man in front of her, finishing his intake questions, but she repositioned herself subtly. One step closer to the counter's edge, one angle adjustment so she could see both the hallway and the doors without turning her head. Her breathing remained slow. In through the nose, out through the mouth. Automatic. Years of repetition embedded in muscle memory she never discussed. A paramedic burst through the side corridor with a patient on a stretcher, blood soaking through a makeshift bandage on the man's shoulder. Protest injury, the paramedic said quickly. Blunt trauma, possible fracture. The room shifted, attention pulling toward the stretcher. The rookie nurse stepped forward without hesitation, hands already gloved, voice calm as she directed the stretcher into a treatment bay. Her movements were economical. No wasted motion. She cut away fabric, assessed bleeding, applied pressure with steady compression. Her eyes flicked once toward the entrance again. The shouting outside had grown louder, closer. The automatic doors slid open briefly to admit a gust of air thick with smoke and street noise. Then they closed again. One of the junior doctors whispered that security should lock them. The guard hesitated. Protocol required a supervisor's approval. The rookie nurse finished stabilizing the patient and stepped back just as another nurse took over. She removed her gloves and disposed of them, fingers steady. "We may need to prepare for multiple arrivals," she said quietly to the charge nurse. Not alarmist, just factual. The charge nurse frowned but nodded, beginning to coordinate overflow space. The rookie nurse moved to adjust a crash cart that sat partially blocked by a chair. She aligned it with the wall, wheels unlocked, path clear. She checked the oxygen tank pressure without being asked. No one noticed. Outside, something struck the glass doors hard enough to rattle them. A sharp crack echoed through the lobby. Several patients gasped. The security guard finally lifted his radio and called for backup. The rookie nurse did not flinch. Her eyes tracked the angle of the doors, the spacing between the waiting chairs, the distance to the nearest solid wall. She calculated without appearing to calculate. The shouting turned into a single voice, screaming something unintelligible. Then another impact. The glass held, but barely. A senior nurse told everyone to remain calm. The rookie nurse stepped slightly to her left, creating a line of sight down the entrance corridor. She lowered her shoulders, letting her posture appear smaller, less noticeable. She felt the familiar tightening in her chest, not fear, but readiness. A memory surfaced uninvited. A different building, different doors, the sound of boots instead of hospital shoes. She pushed it away. That was not who she was here. Here she was a nurse. Her job was care, stabilization, preservation of life. The doors trembled once more. A patient near the entrance began to cry. The rookie nurse's gaze sharpened, not with panic, but with decision. Something was about to cross that threshold, and when it did, everyone in the room would look to security, to the doctors, to anyone else. No one would look to her. She adjusted the cuff of her scrub sleeve and waited. The glass did not shatter, but the doors flew inward with enough force to slam against their stops. The sound silenced the room more effectively than any alarm. A man stepped inside with a rifle strapped across his chest and one hand gripping the front sling, the other wrapped tight around the pistol grip. His face was flushed, eyes wide, breath sharp and uneven as if he had run hard and far. Smoke drifted in behind him from the street. Conversations died mid-sentence. A child screamed once before being pulled down to the floor by her mother. The security guard froze, radio half raised, unsure whether reaching for his sidearm would escalate what was already spiraling. The man swept the muzzle across the lobby without firing, but his finger rested dangerously close to the trigger. "He needs help, pray," he shouted, voice cracking. "Right now." Two others dragged an injured protester through the doorway behind him, the wounded man barely conscious, blood darkening his shirt. The rifleman kicked the doors shut with his heel and advanced 2 steps into the ER, planting himself between staff and the exit. The rookie nurse did not move immediately. She watched the way the sling was adjusted too loose, the way his support elbow flared outward instead of anchoring inward for control. He was not holding the weapon like someone trained to use it under pressure. He was holding it like someone afraid of losing it. Fear made hands unpredictable. "Everyone back," he yelled, raising the muzzle higher. A doctor instinctively stepped forward with both palms out, voice trembling as she tried to de-escalate. The nurse saw the doctor's mistake before it finished forming, the slow approach directly into the man's line of sight, forcing him to track movement while already overstimulated. The nurse shifted instead toward the injured protester, keeping her posture low and non-threatening. "We will treat him," she said evenly, not loud, not challenging. Her tone cut through the noise because it did not compete with it. The man's eyes flicked toward her. He saw the badge. Rookie safe, non-threatening. He jerked his head toward a treatment bay. "Move," he ordered. The 2 men dragging the injured protester complied immediately, hauling him toward the nearest open space. The nurse walked ahead of them, guiding the stretcher into position with efficient movements, never turning her back fully on the rifleman. She noted the distance, 12 feet from him to her, 10 feet from him to the nearest cluster of patients, 6 feet from his right side to the counter edge that could block lateral movement. The security guard had begun inching toward the wall, trying to position for a clearer angle. The nurse subtly shook her head once, barely perceptible. Not yet. The rifleman's breathing was accelerating. His voice cracked again as he shouted about police outside, about betrayal, about someone being left behind. His words overlapped each other. He was losing coherence. That was more dangerous than anger. The nurse began assessing the injured protester with calm efficiency, checking airway, pressing gauze to a bleeding laceration, issuing short instructions to another nurse without looking away from her patient. "Saline, large bore IV." Her hands worked steadily, but her mind mapped exits, obstacles, timing. The rifleman took 2 steps closer, hovering over the treatment bay. The muzzle dipped slightly as he leaned to see the wounded man's face. That shift told her something important. His priority was the injured protester. The weapon was leverage, not objective. "He's going to die if you don't hurry," he barked. "He's not going to die," she replied calmly, applying pressure with precise force. "But you need to step back so I can see." It was a command disguised as a request. He hesitated, then obeyed, half a step. The nurse registered the compliance. Small, but real. Behind her, she could sense staff flattening themselves against walls, holding breath. The security guard had radioed for police, but sirens were still distant. Time stretched thin. The rifleman suddenly swung the muzzle toward a movement in the waiting area, an elderly man trying to crawl behind a chair. "Stay down," he screamed, voice cracking into near hysteria. The weapon wavered, barrel floating unsteadily. The nurse's pulse slowed instead of quickened. This was the fracture point. His attention split between control and fear. She needed him closer to the bed, not scanning the room. "He's losing blood," she said firmly, pressing gauze harder so a small bloom of fresh red spread into view. It was not exaggerated, but it was visible enough to draw his focus back. He stepped in, leaning over the bed again, rifle angled awkwardly across his own torso now. The sling caught slightly against the railing. His support hand loosened for half a second to adjust it. The nurse saw the shift before it fully happened. The weight of the weapon moved off-center. His stance narrowed unconsciously as he tried to look past her shoulder. He was too close. Closer than he should have been. She lowered her gaze submissively, as if intimidated, and reached for another bandage. Her body angled just slightly inside his reach, her shoulder nearly aligned with the rifle's forend. Anyone watching would see a frightened rookie focused on her patient. They would not see the calculation in her eyes. The sirens outside grew louder now, approaching fast. The rifleman heard them too. His head snapped toward the doors, and in that fraction of distraction, the balance of the room shifted. The nurse felt it, the precise fleeting moment when fear overtakes intent. The rifleman tightened his grip and began to raise the weapon again, panic rising. She exhaled once, steady and measured. The window for talking was closing. The window for action was about to open. The sirens outside grew sharper, closer, cutting through the glass and steel like a rising pulse. The rifleman's head turned toward the entrance again, his eyes widening as red and blue light flickered against the ceiling tiles. His breathing lost rhythm. The muzzle began to lift, not toward a target, but toward the room itself, a reflexive reaction to pressure. The rookie nurse did not look at the lights. She looked at his hands. The support hand was still adjusting the sling, fingers tangled for half a second in nylon. The primary hand tightened instinctively on the pistol grip, but the barrel drifted upward, unanchored. His stance narrowed further as he shifted weight to pivot toward the doors. That narrowing was the mistake. She moved before thought could interrupt it. One controlled step forward, closing distance instead of retreating. Her left hand shot to the rifle's forend, not to rip it away, but to redirect the muzzle sharply toward the floor with downward force. At the same time, her right shoulder drove into the inside of his chest, collapsing his balance backward. The movement was compact, efficient, designed to control the weapon first, the body second. The barrel struck the tile with a dull crack. His finger jerked, but the angle forced any potential discharge into the ground. Her foot hooked behind his ankle in the same motion, and she rotated her hips, turning his instability into a pivot. He fell sideways rather than straight back, disoriented by the sudden loss of vertical control. She stayed attached to the rifle, never letting it float free. The sling tightened awkwardly around his torso as he hit the floor, which worked in her favor, pinning the weapon between them. He tried to roll, to regain leverage, but she had already shifted her knee across his upper arm, trapping it against the tile. Her right hand slid from the rifle to his wrist, applying pressure just below the thumb joint and rotating outward. It was not violent. It was precise. Pain compliance without bone breakage. His grip faltered. The rifle clattered free. She kicked it out of reach in one smooth motion without looking at it. The entire exchange lasted less than 3 seconds. Staff had not even begun to scream yet. The man tried to buck upward, adrenaline surging, but she adjusted her weight lower, closer to his shoulder line, reducing his ability to twist. Her knee pressed into a nerve point along his triceps, forcing his arm flat. "Do not move," she said, voice level, almost quiet, not a shout. A statement. He struggled again, weaker this time, confusion overtaking rage. She shifted her hold into a controlled joint lock, rotating his wrist behind his back while keeping his elbow aligned to avoid permanent damage. She felt the exact threshold where ligaments would tear. She stopped just short of it. Restraint mattered. Security finally moved, rushing forward with plastic cuffs in shaking hands. "Cuff him," she instructed calmly, never lifting her knee until the restraint clicked into place. Only then did she release pressure gradually, ensuring he did not surge upward again. The man lay on the tile, chest heaving, eyes unfocused as reality caught up with him. The rifle rested several feet away, harmless now. The room remained frozen in stunned silence. The injured protester on the bed moaned faintly, pulling attention back to why any of this had begun. The nurse rose smoothly, adjusting her scrub sleeve as if she had merely repositioned equipment. She retrieved the rifle herself, clearing the chamber with practiced efficiency and setting it safely on the counter out of reach. No flourish, no announcement. She checked the tile where the barrel had struck. A small crack, nothing more. Then she turned back to the treatment bay. "We need to continue," she said evenly, as if reminding everyone of an unfinished task. The spell broke. Doctors rushed in, Another nurse resumed compressions on the wound. The security guard stood staring at her, trying to reconcile the badge that read "Rookie" with what he had just witnessed. She ignored the stare. Her pulse had already settled. Hands steady again, she resumed pressure on the injured protester's wound, voice soft and clinical as she directed IV flow rates. On the floor, the restrained gunman began to cry, not loudly, not violently, but with the hollow exhaustion of someone who had run out of fear. She did not look at him. She focused on the patient. Outside, police boots thundered toward the entrance. Inside, the emergency department returned to motion as if chaos had been a brief interruption rather than a turning point. Lowering their stance, they moved toward lowering their stance. They moved toward the restrained man on the floor, taking custody with efficient commands and firm grips. The rookie nurse stepped back without being asked, palms visible, posture neutral. She did not explain what had happened. She did not need to. One officer glanced at the cracked tile, then at the rifle resting safely on the counter, chamber open. His eyes shifted to her hands. No tremor, no shock delay, just steady breathing and a faint smear of dust across her sleeve. "Who disarmed him?" the officer asked. The security guard hesitated, then pointed toward her. The nurse was already turning back to the treatment bay. "Patient first," she said quietly. The officer studied her for a moment longer before nodding and redirecting his attention to securing the weapon. The injured protester required sutures and imaging, but would live. The crisis, at least medically, had stabilized. The emotional atmosphere had not. Staff whispered in fragments behind curtains. Words like how and when and who drifted through the air. The charge nurse approached her slowly, eyes searching for something. Fear, maybe, or adrenaline, but found neither. "Are you hurt?" she asked. "No," the rookie nurse replied. She checked her knuckles briefly. Slight redness, no swelling. She rotated her wrist once, subtle, assessing strain. Nothing serious. Across the room, an older police sergeant entered, removing his cap as he surveyed the scene. His gaze paused when he saw the restraint position used on the suspect before transport. It was clean, technical, minimal injury. He walked toward her as she disposed of bloodied gauze. "You've done that before," he said, quietly, not accusing, just certain. She met his eyes briefly, then looked back at the biohazard bin. "I've had training," she answered. It was neither denial nor confession. The sergeant nodded once, as if confirming something to himself. He did not press further in front of the others. Instead, he lowered his voice. "That wrist rotation, most civilians overextend it. You didn't." A pause. "You stopped exactly where you needed to." She wiped her hands with methodical care. "He was scared," she said. "He didn't need a broken arm." The sergeant studied her face, searching for ego, for pride. There was none, only fatigue settling in beneath the surface. He recognized that too. "We'll need a statement," he said finally. She nodded. "After my shift." It was not defiance. It was priority. He considered objecting, then glanced at the busy ER, the incoming ambulance notification flashing on the monitor, the staff still regaining composure. "After your shift," he agreed. When he stepped away, the charge nurse returned, voice softer now. "You never mentioned anything like that in your background." The rookie nurse adjusted an IV line, eyes on the drip chamber. "It wasn't relevant." The charge nurse hesitated. "It was today." The nurse paused just for a second. In that pause lived something heavier than the room could see. Long nights in different uniforms, commands shouted in harsher places, the weight of choices that did not always end with everyone alive. She had left that world for a reason. The hospital was supposed to be simpler. Lives saved one at a time. No tactical formations. No aftermath reports measured in casualties. "It shouldn't have been necessary," she replied quietly. The injured protester stirred, disoriented. She leaned closer, voice calm, explaining where he was, what had been done, what would happen next. She did not mention the rifle. She did not mention the man now in custody. Care did not change based on ideology. Blood was blood. As the adrenaline faded, a dull ache began to form along her shoulder where she had driven into the rifleman's chest. She rotated it once when no one was looking. Pain was information, nothing torn, just strain. The security guard approached awkwardly, gratitude heavy in his expression. "You saved us," he said under his breath. She shook her head slightly. "We stabilized the situation." Language mattered. He nodded, unsure how to respond to that. Across the department, administrators began discussing incident reports, media protocols, potential statements. Her name floated in those conversations. She heard it and quietly stepped into a supply room, closing the door for a moment of stillness. The hum of fluorescent lights filled the small space. She rested her hands on the metal shelf and allowed herself one slow exhale. Not relief, not triumph, just release of tension. She remembered another room years ago, another aftermath, where applause had felt hollow and loss had been louder than praise. Recognition did not repair what was broken inside. It only drew attention to it. A knock at the door broke the silence. The sergeant stood there again, this time alone. "Off the record," he said gently. "If you ever need to put something like that back on your resume, there are people who would vouch." She met his gaze steadily. "I didn't leave because I couldn't do it," she said. "I left because I could." The meaning settled between them without further explanation. He inclined his head in quiet respect. Understood. When she stepped back into the ER, the chaos had thinned into routine. Stretchers moved, monitors beeped, life continued with indifferent persistence. She picked up a chart and returned to triage, the word rookie still visible beneath her name, as if nothing had changed at all. By the time her shift neared its end, the emergency department had returned to its usual rhythm, as if the breach had been absorbed into the building's walls and filed away like any other incident. The cracked tile near the entrance had been taped off for maintenance. The rifle was long gone, logged into evidence. The restrained man had been transported under guard. What remained was a thin undercurrent in the air, staff speaking more softly than usual, glancing at her when they thought she would not notice. She completed her charts without delay, documenting the injured protesters' intake, treatment, and stabilization in precise clinical language. No mention of the takedown beyond a brief factual note. Weapons secured, patient and staff unharmed. Nothing dramatic, nothing self-referential. The charge nurse approached once more, holding a clipboard a little too carefully. "Administration would like to formally recognize you," she said. "Press may ask for a statement. They're already outside." The rookie nurse did not look toward the doors. "There were many people involved," she replied. "Security responded. The doctors treated the patient. That's the statement." The charge nurse studied her face, searching for reluctance born of fear. What she found instead was intention. "You're certain?" she asked quietly. "Yes." A pause, then softer. "I prefer to keep my role here simple." The charge nurse nodded slowly. "Understood." When the police sergeant returned for her official statement, it was taken in a small consultation room, away from cameras and administrators. She described the sequence of events clearly, without embellishment, focusing on timing, distance, and observable behavior. The sergeant listened without interrupting, pen moving steadily across the page. When she finished, he closed the folder and looked at her for a long moment. "You prevented a shooting," he said, not as praise, but as fact. She considered that, then answered evenly. "I prevented a discharge." The distinction mattered to her. He gave a small, almost imperceptible nod. "If you ever reconsider," he said quietly, "the door isn't closed." She met his gaze. "That's why I left," she replied, "because the door is never closed." There was no bitterness in her tone, only certainty. He stood, extended a hand. She shook it once, firm and brief, no ceremony. When he left, she removed her badge and placed it in her locker, the word rookie catching the fluorescent light before disappearing into shadow. She changed slowly, wincing slightly as fabric brushed her sore shoulder. The ache would fade in a day or two. Bruises were predictable. Outside, reporters clustered near the entrance, cameras angled toward anyone in scrubs. She exited through a side corridor instead, stepping into the cooling night air without announcement. The distant echoes of the earlier protest had faded into scattered voices and police radios. The city had already begun to move on. She paused beside her car for a moment, breathing in the quiet. No applause followed her. No one called her name. Inside the ER, another shift would take over, another set of patients would arrive, and the story would compress into a line item in a report. That was enough. Her phone buzzed once with a hospital-wide message thanking staff for professionalism under pressure. It did not mention her specifically. She turned the screen off. In the reflection of the car window, she saw only a tired nurse with a faint mark on her sleeve where dust had settled. Nothing more. She opened the door, then stopped as the side entrance behind her creaked open again. The security guard stepped out, hesitating. "I just wanted to say," he began, then faltered. Words felt too small. She spared him the effort. "We all did our jobs," she said gently. He nodded, accepting that answer even if it felt incomplete. "See you tomorrow," he asked. "Tomorrow," she confirmed. She drove away without headlights flashing or engines roaring, just another vehicle merging into traffic. The hospital